Hi everyone, this is Brenda Green. Welcome to my presentation from my community visit to Labrador Grenfell Health. LG Health is the regional health authority that looks after all of Labrador and a little bit of the northern peninsula of Newfoundland. And the main reason I went over there today was to talk about tuberculosis prevention, which has become a huge issue recently in Labrador. So just a quick overview of what I'm going to cover in my slideshow. First, we'll talk a little bit about what tuberculosis is and why it's an issue. Next, we'll look at the objectives of Labrador Grenfell Health, the target audience for their TB prevention programs, the principal activities of their TB prevention programs, the strengths and the limitations observed within Labrador Grenfell Health, both broadly and with regards to TB specifically. We'll also look at partnerships and collaboration, as well as future requirements for success and aspirations of some of the staff. So tuberculosis, or commonly TB, is a disease that's spread by bacteria through the air from person to person. Main routes are coughing, sneezing, speaking, or singing. TB is most commonly referred to in two different terms. The first is latent TB infection. This is when an individual is infected but doesn't feel sick and doesn't show any symptoms. During this latent infection period, individuals cannot spread TB bacteria to others. However, the TB bacteria in the body can become active and lead to active TB later in life. This is specifically important during times of vulnerability, such as when the immune system is weakened, when other diseases are present, that sort of thing. TB can also present as active TB or TB disease. Common symptoms include a cough lasting more than 3 weeks, chest pain, and also coughing up blood or sputum, which is the mucus that comes up from your lungs. During active TB, individuals can spread TB bacteria to others. Within Labrador Grenfell Health region, TB is of a particular concern because there are very high rates among Inuit populations, which we have in Labrador. And there's also been recent outbreaks in Nain and Hopedale, which are along the north coast of Labrador. And as a happy coincidence, I just happened to do my visit about TB prevention today, March 24th, which is World Tuberculosis Day. So for the objectives of Labrador Grenfell Health, the agency itself has overarching goals and guiding principles. Their vision is healthy people living in healthy communities. And their mission is to improve accessibility to selected health and community services to better meet the needs of people within the region. So this vision and mission really guide all of the activities within Labrador Grenfell Health, regardless of the type or the program. For tuberculosis specific objectives, they talked about delivering care in a timely and fair manner, as well as ensuring adequate clinical assessments, contact tracing, and screening to better support prevention of tuberculosis and treatment of active cases. So the target audience for TB prevention among Labrador Grenfell Health, in general, it includes all residents within Labrador Grenfell Health's region. So that is everyone north of Bartlett's Harbour on the Northern Peninsula and all of Labrador, which you can see as the shaded green area on the map on the top right hand corner of this slide. During outbreaks specifically, the target audience sort of shifts and they would focus on the residents of affected communities. Recently, this has been Inuit communities along the north coast. They also may focus on particular subgroups of affected communities. So recently, this has been youth. And when we were talking about this today, we kind of came to the conclusion that the target audience can change, based on the situation and the demographic characteristics of affected individuals. Um, while, of course, we want everyone to benefit from prevention campaigns, sometimes it's necessary to target specific populations and subgroups that really need the most at that time in regards to prevention and treatment. So next we'll look at the principal activities of Labrador Grenfell Health. For primary prevention, they are very active with awareness campaigns. And actually just yesterday, they hosted a luncheon at the emergency shelter here in Goose Bay, as well as in community centres along the North Coast. And the nurse referred to it as TB 101. They provided some basic information, a healthy lunch, and just tried to increase the knowledge and awareness around tuberculosis in the area. They also provide educational materials, so posters, pamphlets, and brochures. And they also do a cough registry program. So this is a program implemented in community clinics where they flag individuals with a cough lasting greater than 3 weeks for additional questions and testing. This is an active surveillance method, like I said, carried out at every clinic within Labrador Grenfell Health Region. And even though not everyone presenting with a cough is infected with TB bacteria, but it's a good way to start the conversation and to get people on the right track of testing and screening to try to catch cases earlier and earlier. So for secondary prevention activities, one of the big ones is contact tracing. So anytime there's a confirmed case, the CDC nurses with Labrador Grenfell Health will contact family members, close friends, even employees that work in the same close area as a confirmed case. So this will lead to sputum sampling and chest x-rays, just to try to, again, catch cases that you may not otherwise have caught until they hit the stage of experiencing symptoms. Isolation of confirmed patients is another one, and Labrador Grenfell Health always tries to treat patients in their home community and avoid travel as much as possible. And again, this might be more primary prevention than second, as it's, again, a precautionary measure taken to limit the spread of tuberculosis as much as possible. And another activity is past cases are always followed by a physician, especially latent TB, so that if it starts to switch from latent TB to active TB, it's caught earlier and again can be treated earlier. And for tertiary prevention activities, this involves treatment and rehabilitation. The great thing is TB is curable. So for latent TB cases, they administer direct observed prophylaxis, which is a biweekly treatment for 9 months. This is done to decrease the risk of progression from latent TB to active TB. For cases of active TB, there's a course of 4 antibiotics, which takes place daily for 6 to 9 months. And this is done in the home clinics and has to be observed by a public health nurse or a nurse with the health authority. So some of the strengths and limitations for TB prevention with Labrador Grenfell Health, we had quite a lengthy conversation about this one. So within Labrador Grenfell Health itself, some of the strengths are that it's a small organization, and the way it was worded was that there were less loopholes to jump through if you needed to do something or needed a decision made. And it also consists of a close-knit team that has become really invested in tuberculosis prevention, treatment, and care. They do have a TB outbreak management team that is kept consistent during outbreak situations, and there is significant government support when decisions need to be made and resources need to be provided. The staff, actually the epidemiologist, is working on developing a TB database. They're currently in the data entry stage and hoping to roll out the program soon, which will lead to increased sharing of data between different areas, as well as increased accessibility and the ability to run reports much more quickly than if you had to go through paper files between all of the different community clinics. And the last one, there's also been new equipment secured for remote sites. Not all of the communities on the North Coast have the facilities that we have here in Goose Bay. So they have been able to secure some new equipment to make it easier to do testing and screening in those remote areas. So the limitations, of course, like many other programs, the first one that came out was budget cuts. Everyone is seemingly having to do more with less in the recent fiscal climate. Another one was high staff turnover rates, and this is common all across Labrador. People come, they stay for a year or two, and then they go on to a more urban centre. Another one was the lack of services in the communities, and this isn't just necessarily services in community clinics. It's also just simple things like when a patient doesn't have a home phone and there's no cell phone service, so it's very hard to get a hold of them. Another one was travel for follow-up. So if you think of someone in Nain, if they have to come to Goose Bay for treatment, they have to fly out, they have to find somewhere to stay in Goose Bay, they have to miss work, they might have to find someone else to look after their children. It's just a big ordeal. So that's why Labrador Grenfell Health tries to do as much treatment in the community as possible. And there are also cultural barriers. A lot of the staff from Labrador Grenfell Health kind of get the sense that when they ask people to do something, that it's being received as, well, you're telling us what to do. So there's still a little bit of a cultural divide, I guess. So it is, that is something that does present challenges. Fortunately, Labrador Grenfell Health does have a very good partnership with the Nunatsiavut government's Department of Health and Social Development. This agency is responsible for public health services to Nunatsiavut beneficiaries. So they provide services in Nain, Hopedale, Makkovik, Postville, Rigolette, Happy Valley Goose Bay, and Northwest River, and Black Tickle. So Labrador Grenfell Health and the Nunatsiavut government are both heavily involved in TB prevention and care. They coordinate on awareness campaigns and educational materials, and treatment and care are a joint effort between the two agencies. And one of the things that was mentioned during the interviews was that Nunatsiavut government needs to share a little bit more in the outreach to the community, so that it no longer seems like Labrador Grenfell Health is trying to tell people what to do, but that Nunatsiavut government is trying to improve the situation of their own people, kind of thing. So again, just a little bit of a step to compensate for or overcome the cultural barrier that is sometimes encountered. So when asked about what was needed for Labrador Grenfell Health to be successful, the nurse joked and said, "I need a money tree." Money is always a huge issue, not only for better equipment, but for better educational resources. One of the things they mentioned in particular was a portable chest x-ray, something that they could ship up the coast that could be used in the clinics so that not everyone had to fly into Goose Bay when they needed an x-ray. The other thing was health promotion. The CDC nurse said, I would love to have more time to get out into the schools and the communities. Right now, they've got limited resources that are currently stretched as thin as they can go. So current outbreaks and care take priority, and unfortunately, the education and the health promotion side of it gets pushed to the back burner. So she finds that really frustrating, and like she said, she would love to have more time to focus on the health promotion side of it. So that's my presentation. I have to give a shout out to the two lovely ladies um, that I chatted with today. Sharon Lethbridge, she's the communicable disease control nurse here in Goose Bay, as well as Kadisha Ibrahim, who is an epidemiologist slash analyst working with Labrador Grenfell Health. I also have to apologize. The picture that you saw on the first slide was me walking into the administrative building. Once I got inside and started talking to Sharon and Kadisha, I completely forgot about my camera. So you just get that one picture. Apologies. And I just have one reference, and I look forward to discussing any questions or comments that you guys may have on this presentation. Thanks.